clipping and coiling, the difference. Surgical clipping is something we've been doing for decades, and we still do it basically the same way as it was done decades ago. It's a very good procedure to treat aneurysms. The way you have to do it, usually you make an incision. It goes from, let's say you're on the right side, it goes from right anterior to the ear right here, kind of curves forward and anteriorly and ends up right here, kind of an incision like this. Then you pull the scalp forward, exposing this area here on the skull and the frontal area, and then we use a drill, high-speed drill, to actually take the bone window out, cut a circular piece of bone, and a lot of times we actually take the roof of the orbit that covers the eyeball off with it in one piece, and then that allows us access to the brain. Then we go in between the lobes of the brain with gentle retraction. We can identify where the aneurysm is, basically dissect it away from the surrounding brain and surrounding vessels, and then put a clip, a titanium and metal clip across the neck, so blood can't get in there anymore. Therefore, it doesn't exist anymore once you clip it. It's a curative procedure. So that's surgical clipping. The clipping procedure takes about an hour and a half, at most 2 hours from beginning to end. It does involve going inside someone's brain though. So it's completely different than aneurysm coiling, which is minimally invasive. There's no cracking somebody's head open, there's no incision. We basically go through the artery in the leg, all the way up to the arteries of the neck and head, and get inside the aneurysm from the inside with a tiny little catheter, and then fill it basically full of soft platinum coils. And once the aneurysm is filled from the inside, then blood can't get in there anymore. It's as if it didn't exist. So that procedure takes about 45 minutes or so. It's a little bit shorter than the surgical procedure. The recovery time is a lot shorter with coiling because it's minimally invasive. There's no incision, there's no swelling, there's no pain. Frankly, people could probably go home that day, but we just keep them for observation overnight just in case there's a problem. And then they go home the next morning. There's no restrictions. They go back to their normal daily activity. They can start exercising in a couple days. It's not. It's a pretty remarkable way to fix life-threatening condition.